Welcome to Lok Talks. This is Dr. Lokesh Bhatia. Subscribe this channel for professional medical guidance, spirituality and meditation, life coaching, personality development, and travelogues. Thank you very much to be a part of my viewership team. Thank you very much. Hello and welcome to Lok Talks. This is Dr. Lokesh Bhatia. Dear friends, today I am making a video on our public awareness campaign, and that is a lot of people come to me and to all my other colleagues as well, and it has been my observation for last 25-30 years in medical practice now, that for pain they demand to receive injection, and they many times force us doctors, and many times they complain against us also that we were not given injection. In spite of that, I had a lot of pain. And when we ask them to grade their pain, that grading in their pain is not that severe, and still they are demanding for injectable medications for addressing their pain. Well, I have recently come across, you also must have come across this news, that recently a medical doctor who was doing a post-graduation in doing her MD Anaesthesia in India died after receiving intramuscular Diclofenac injectables, and within no time after injection she had to be shifted to ICU, and the world lost a wonderful young doctor. Peace be upon her, and my all sympathies with her family. And this injection was given by her own husband at home, who himself is doing MS Gen Surg. So you can see what can happen. As for the current medical sciences, where as of now there is one thing is very clear, my dear friends, as far as possible intramuscular injection should be avoided, number one. Number two, avoid receiving Diclofenac injections. Number three, at least if it is mandated to be given, do one test dose. It's not that I never given, I do give it, but before giving injectable Diclofenac, I do give a test dose intradermally and observe the patient for 15-20 minutes, many times half an hour too. What protocol I have made is, I give them intradermal test dose, then ask them to go for x-rays. By the time they come back to the injection room, it is already 15-20 minutes, many times 30 minutes have passed. Adequate time duration, we have observed the patient, and if there is no reaction, then only we give full dose. Whatever number of times one might have received it before, doesn't matter. Whatever the while you are going to use it for giving that drug, give a test dose and then give it. Many times different batches may have different chemical composition, and one might develop severe anaphylactic reaction, like in this incidence, and there have been some incidences in the past also. It is claimed that it is because of the Kunis syndrome, which is acute anaphylactic reaction, and suddenly the coronary artery goes into spasm because of the anaphylactic reaction. I will not go much in details to cover up Kunis syndrome, but my idea of this video is to give a general awareness to all the people who come and demand to all the doctors for getting injection, particularly intramuscular, to relieve their pain. We do understand that you have severe pain, but medications works fantastic. Oral medications do fantastic job. If ever you need it, take 2 tablets of paracetamol, which is over the counter OTC product available in any of the malls, any of the pharmacies. You can just walk in and get tablet paracetamol, which can safely be taken for 3 to 5 days time, especially in such indications, such situations when one received COVID injection. We all know that myalgias can happen with any any viral infection, myalgia is the very dreadful manifestation. Even after vaccination also this can happen. So whenever this happens, make sure that you first hydrate yourself very well. Number 2, lie down, take full bed rest. And number 3, just take paracetamol 1 to 2 tablets 3 to 4 times a day. With interval of 6 to 8 hours, it can be taken. Maximum dose of paracetamol, safe dose is 4 grams in 24 hours, whether injectable or oral. Also injectable paracetamol is also available, 100 ml vial intravenously. It can be safely be given, but for that you will have to walk in to the nearest clinic or to nearest hospital in emergency. So my dear friends, there are a lot of people, just for their psychological satisfaction, they do insist to the doctors, and if they are not advised, they don't feel happy about their consultation from the doctor. It is not wise in this particular corona situations to receive any intramuscular injections, especially NSAID injections. All this Diclofenac, paroxychems, all these falls into a common category of NSAIDs, non-steroidal anti-inflammatory drugs. There are more safer drugs which can be taken orally. Let the doctor treating you decide what is the best for you. Please don't force the doctors. Don't feel dissatisfied with their opinion. Every doctor will give the best out of his experience and their qualifications. So, my dear friends, I hope I am very clear about it. Try your best to avoid intramuscular injections in this time period. Body is reacting in very different manner. We never know how things can react and what can happen. Human body is a very complex phenomenon. The world is still, after all these medical advancements, world is still trying to understand what is going on. So at least what best contribution you can do is stick to the doctor's advice. If they are advising you it's not right to receive injection, accept it. Don't force them. Don't feel dissatisfied. There is no role of receiving intramuscular NSAID injections. As of now, there is no reason to receive intramuscular vitamin B12 injections. I get a lot of patients in my OPD coming in follow-up. First injection they received in India by someone, and then they want to receive follow-up injections. Again, that's not needed. Vitamin D can be taken orally. Vitamin B12 can be taken orally. There is no reason to receive any intramuscular injections for these commoner things. As far as possible, should be avoided. Try your best to stick to your doctor's advices. Thank you very much. All the best. God bless you. Take care.